So I'm going to make a confession. I actually didn't think this was the next video that I was going to do. But here we are in the middle of a public health crisis of international proportions, and we're trying to figure out where we all fit in. And all of this is for a virus that's supposedly like the flu, causing a flu-like illnesses that doesn't kill as many people as the flu. So why are we all freaking out? Is this all hype? Well, if you want to find out my answer to this and what I think and why I think that, stay along with me. This video is going to be a little bit longer than my usual 5-minute videos. If you don't have a lot of time, the short answer is this. This virus is not the flu. It's far more dangerous. And it's dangerous perhaps not for the reason you think, not because of its mortality. So one of the problems I always run into people who I have discussions about this virus with is the inevitable comparison to influenza. A lot of people will tell me, listen, a lot of people die with the flu every year. A lot of people get the flu every year. And we get the flu every year and nobody seems to bat an eyelid. But then suddenly the coronavirus comes out of nowhere and its mortality rate is lower than the flu. It infects less people than the flu. And so far, fewer people than the flu have gotten killed and everybody is freaking out. This virus is more serious than the flu, but it's serious for a different reason. Although in terms of number of people affected every year, this virus doesn't even crack the top 10 causes of death. It is also not wise to blow this virus off as just the flu. Here's why. Let's do the comparison with the flu and starting with mortality rate. So as a sidebar, let me explain to you what mortality rate is. Mortality rate is calculated by taking the number of people who die from this infection and dividing it by the total number of people who have the infection. Now we know that for this particular coronavirus, the actual mortality rate is somewhere around 1%. The actual figure is imprecise because there is so much variability from country to country. The current US data hover at approximately 2.2%. But remember, we also don't have the total numbers yet. We don't have a good test in America, and as a result, as we develop a better test and start testing more and more people, that denominator is going to expand and overall the mortality rate is going to be reduced. That being said, every study done so far shows that this virus is still at least 10 times deadlier than the common flu. The second reason that this virus is more dangerous is because unlike influenza, there is no treatment or vaccine available. Now, there are some treatments in the pipeline, but nothing is set in stone, and we are at least 18 months away from having a proper vaccination. Number 3, immunity. We have no innate or acquired immunity to this particular virus. Innate immunity is the immunity that you have from birth that helps you fight off certain unknown viruses. Acquired immunity is the immunity that comes from your body having seen a virus before. So when it comes to influenza, for example, all of us in some way, shape, or form have seen this virus before, and we have some acquired immunity to it. We have none for the coronavirus. Then there's also the issue of demographics. You see, influenza usually affects the youngest in our population and the oldest in our population. The coronavirus seems to affect the elderly population preferentially over the youngest. So in children, the mortality rate is about 0.2%, and that's quite low. But when it comes to the elderly population over the age of 80, your mortality rate with this virus can be as high as 15%. In addition, depending on what other pre-existing conditions you have, your mortality rate can be different. So people who have prior heart disease have a mortality rate in excess of 10% with this virus. Despite the fact that the mortality rate might be higher than the flu, the good news is that for most of us, we'll get the virus, we'll have influenza-like symptoms, we'll be home for a few days, and then we'll go on with our lives as usual. But about 15% of us will get sick enough that we'll require hospital admission. And about 5% will be so sick and critically ill that they will require intensive care, requiring the use of a ventilator. Why should I be concerned? Well, you should be concerned for a couple of reasons. Number 1, remember, this virus has not had enough time to show what it's made of. Before Thanksgiving, this virus didn't even exist. Number 2, the ease of spread of this virus puts it in a very particular category. This virus is easy to spread, and there are 3 reasons for that. Number 1, this virus is spread by aerosolization and droplets. That means every single time somebody coughs or sneezes, tiny microscopic aerosolized particles are suspended in the air, and these particles can travel over the air and land on somebody else. Number 2, this is one very hardy virus. There's a new paper that just came out that will be published soon in the New England Journal of Medicine that looks at how hardy this virus is. Once aerosolized, this virus can last for a few hours, and on surfaces such as plastic and stainless steel, it can last for up to 3 days. That is downright scary. 3, the other reason that this virus is so easy to propagate is because of something called asymptomatic spread. You see, most people who get this virus either get a very mild flu-like illness or sometimes no symptoms at all. And when they don't develop symptoms, they can continue to spread the virus without even knowing it. In fact, most people will continue to spread the virus for about 7 to 14 days before they even realize that they're actually sick from it. This is a very scary finding because this means that each person who gets infected with the virus can come into contact and infect roughly 4 to 6 other people before they even get ill. So all those points aside, what is the most important reason that makes this virus so scary? And I told you I was going to leave it to the end. Well, the most important reason that this virus is scary is not because of its mortality. It's because of something called capacity threshold. So what exactly is capacity threshold? And let me explain that to you. So capacity is how many patients a healthcare system in any country can support at any given time. But what happens is when a virus spreads so fast through a community, and so many patients are coming into the hospital and overcrowding the intensive care units, the available resources are quickly outstripped by the number of patients coming in. So the ICU beds, ventilators, care providers, they're going to come to a grinding halt. So in addition to running out of, say, ventilators and acute care beds in the hospital, people on the front line of this process, the doctors, the nurses, the respiratory therapists, the pharmacists, and so forth, all those individuals get sick, or they get quarantined, or they die, and they get pulled out of the system, thereby further reducing the capacity of the number of people the system can support. Let me give you an example and elaborate. So with this coronavirus, I just told you that 5%, or roughly 1 in 20 patients, will end up getting intubated and put on a ventilator. And so when they get in on a ventilator, remember, they usually stay ventilated for a few weeks. Meanwhile, every day, a new influx of patients are coming into the hospital because the virus is propagating through the community. Add to that what I just told you. Doctors, nurses, respiratory therapists, they get sick, they get pulled out of the system. So before you know it, hospitals and the healthcare system reach capacity very quickly. If you think that this can't happen to us, think again, because this is exactly what happened in countries like China, Italy, and Iran. The reasons those countries shut down is because their healthcare systems reached saturation quickly. But this is America, right? I mean, this is not going to happen to us. Wrong. In fact, to give you the numbers, the United States has about 34 critical care beds per 100,000 patients, or 100,000 people in the population. For reference, Italy has about 14 critical care beds per 100,000. Italy ran out of beds in a week and a half. This is why doctors in Italy who are taking care of these patients have had to make some very difficult decisions, often pulling out patients who were elderly and sick and had comorbidities to favor people who were younger and had a better chance of life. This is something that no doctor in any industrialized country should have to decide. And if you also think this is not going to happen to us because we're somehow different, I caution you to take a look at these graphs. This first graphic shows you the case numbers between Italy and the United States, and you will see that we are about 11 days behind Italy. This graph shows you the trajectories of the two countries and shows you that we are right behind Italy. So unless we change something, we are going to be in a whole lot of trouble. This has to be our wake-up call. So what can you do about it? Well, in one word, help flatten the curve. Now, the idea of flattening the curve is not some sexy catchphrase. It's actually something that's very meaningful. The curve here is what's called an epidemiologic curve, which shows how the virus propagates through the community. It's a curve that shows the number of cases in one axis and time in the other. But what happens is if you flatten the curve by doing all sorts of non-pharmacologic interventions, the same number of people may get sick, but they get sick over a much longer time frame and thereby never really saturate the healthcare system. This is one of the main reasons that although influenza doesn't scare me, this does. Because influenza is a naturally flattened curve. Yes, we do have more patients, but those patients start in the fall and go all the way to the spring. There are more patients that get sick, but they never overwhelm the resources of the hospital because it doesn't happen at the same time. So this is a very, very important concept to understand. So how do you help flatten the curve? There are a couple of things you can do. Number one is this concept of social distancing. Social distancing is basically a catchphrase for cancel everything. Public events, school, church, office, anything that requires you to interact with another human being that is non-essential, cancel it. The less contact you have with other people, the less the chance there is that you're going to spread the virus unwittingly and you're also going to catch it from someone else. Number two, stop hoarding. Come on. What's the point of going to Costco and fighting over toilet paper or standing in line with 100 other people for toilet paper when the whole premise is social distancing? That's the exact opposite of what you should be doing. Hoarding masks are actually no different from that perspective. And in fact, the Surgeon General issued a notice asking people to not hoard masks because masks are not going to protect you from getting the virus. The only mask that can protect you is something called an N95 mask that filters out more than 95% of particulate material. Most other masks are not going to protect you. That being said, I will tell you that if everyone wore a mask, we would be in a better shape. And the reason for that is very simple. Although a mask doesn't protect you from getting the virus, it certainly does protect you from giving the virus to someone else. You see, you can absorb the virus from a number of different surfaces in your body, not just your nose and your mouth, but your eyes, your hair, your skin. But there's only two surfaces from which you emit the virus, your nose and your mouth. So if everybody covers their mouth, that will reduce the infectivity of the virus. If you look at countries like Singapore, South Korea, and Hong Kong that successfully defeated the virus, this is some of the strategies that they followed. Number four, practice safe hygiene. I cannot tell you this enough. Wash your hands, wash your hands, wash your hands. And when you're done with this, put some soap and wash your hands again, 20 seconds at a time. If you cannot wash your hands, you can use something like hand sanitizer, but make sure that it has at least 60% alcohol in it. If you're using hand sanitizer and washing your hands, try not to touch your face. I bet you after I said that you'll want to touch your face right now. Please don't touch your face. Touching your face is how you can take the virus that's in your fingertips and put it into your body. Lastly, and this is very important, get early testing if you are symptomatic and impose self-quarantine. Now, in America, we're going to have a little bit of a problem because we do not have widespread testing yet, and it'll probably be a few weeks before we have this. But once we have this, if you have symptoms, I urge you to go get tested. If you again look at the countries that were successful at defeating this virus, like Singapore, South Korea, and Hong Kong, this is one of the other techniques that they practiced. They did mass screening and they quickly quarantined and isolated people who were sick so that the rate of propagation of this virus throughout the community was rapidly reduced. So I hope you take this information at heart and do your part as I've instructed here to help flatten the curve. Stay safe, everyone.